Hello, and welcome to this session on information management for GBV analysis and response. My name is Agnes Olusese, and I work with the GBV Global Support Team. I'll be taking you through this session. Information and analysis is fundamental to design responses for GBV in emergencies. This session focuses on how to identify necessary information, how to gather and collect them in line with interagency best practices, the GBV area of responsibility guidance, and grant bargain outcomes. For those of you interested in a more in-depth session on this topic, this is available as DTM standard training session on DTM and Partners Toolkit. So let's begin. At the end of this module, participants should be able to identify common information needed by GBV colleagues, what methods and sources to use for each one, who can collect, list some tips for cooperation between information management and GBV colleagues, and know how to ask for help on challenges related to GBV and data. First, let us see what we mean by GBV in humanitarian crisis. So what is GBV? Gender-based violence is an umbrella term for any harmful act perpetrated against a person's will based on socially ascribed gender differences, gender differences between male and females, and it can include acts that inflict physical, sexual, or mental harm or suffering. It could also be threats of such acts, coercion, and other deprivations of liberty. This can occur in public or private. So how can GBV and information colleagues work better? Under the brand bargain, we have reached a wide and shared understanding on a joint cooperation between data providers, information management, and assessment experts, and data users. In this particular case, we'll be looking at GBV actors and colleagues. The first principle of this approach is that cooperation is a shared responsibility that starts from the planning phase. There are clear roles and responsibility at each step of the process. Some responsibilities can be defined at global level as common across responses, or you can find them in the brand bargain outcomes and in the DTM and Partners Cooperation Guide on the DTM and Partners Toolkit. Others should be agreed upon in country depending on the situation, the resources, and the coordination structures in place. Roles and responsibilities are specific and complementary for information management and gender-based violence actors. Other fundamental principles for cooperation between gender-based violence and the information management colleagues are that each information will be collected through the appropriate method and by the appropriate actor. GBV actors have a variety of information at their disposal, and so do DTM, and this information could be useful for analysis and response planning. Complementarity between this information ensures specific decision-making is based on data that can support it. A shared understanding of complementarities among different methodologies is critical for sound analysis. At all times, the link between collected data sets, their analysis, and their humanitarian response should be clear. In order to ensure we always keep the link between the use of information and the data we collect, it requires us to work backwards. We need to start not from the questions in a questionnaire, but from the use. How are we going to use these questions? How are you going to use this information? What decisions will be made? And then we can now look at the information needed to make that decision. What do you need to make that decision? And this is the information that the data users do not have. It's only at that point that we consider the right method and source of data and design the questions for the questionnaire. Now let us look at who does what. Whose responsibility is it to identify the decisions made and why? Is it a GBV colleague or is it an IOM colleague? When it comes to decisions, the GBV actors should make the decision. They are the ones who will use this information, and they have to tell the IM colleagues the use of the information. So whose role is it to identify the information they need to make those decisions and why? GBV or IM? When it comes to information needed, GBV actors and partners should be the ones to identify, as they know what information they need, and they will tell IM colleagues. They know what they have and what they need, and they can be able to tell the information management colleagues what information is missing for them to make that decision. When it comes to methodology, who identifies the methodology? Why? In this instance, the information management colleagues or assessment colleagues identify the information methodology to use in their context and or tell GBV actors if the information needed can be collected with that methodology. So what do you think? Whose role is it to develop the data collection tools, the questionnaires, data analysis plans to be made, and why? Yeah. Information management colleagues design their questions and mock-up analysis. GBV colleagues advise on language and verify that the information that will be collected can actually be used for analysis for the purpose that they need. So what should be happening is the following. The GBV colleague makes a decision related to the response. What is it that they want to, how do they want to respond in this issue of GBV in a certain regulation? And then they realize that they're missing a crucial part of that information to take the decision. They approach the information management colleague or data collection team and explain the information they need and why they need that information. The information colleague should advise about what method and source to use to collect such information, and together they identify who should collect the information. Is it information management? Is it enumerators, GTM teams, or GBV experts? Information management colleagues will design the data collection tools they will use, but GBV colleagues will advise on language and verify that the expected results correspond to information they need. What may also happen is that IAM colleagues might start a new data collection exercise. For example, DTM might be about to revise their questionnaire. So they will approach GBV actors to ask about the information needs. And GBV colleagues consider the decisions they have to make and explain what information they need to information management colleagues. And the process continues as before. In those cases, when GBV colleagues collect the information themselves, for example, a GBV or protection assessment or monitoring or using focus group discussions, they will develop the data collection tools, and IM colleagues can support if needed. So who is a GBV expert? It's not enough to know something about GBV or have attended a GBV training to become a GBV expert. There are some minimal essential characteristics to be considered before one becomes a GBV expert. This requires experience in managing specialized GBV programming, including GBV assessments, provision of assistance to survivors of GBV, and other components of GBV work as addressing root causes. It also requires experience in practical application of knowledge and skills around gender-based violence programming, and they can guide others around their specialization. This is an individual who has received training on GBV in emergencies and the WHO guidance on GBV in humanitarian settings, and understands the GBV minimum standards. Now let us look at the GBV analysis framework developed by the Global GBV Area of Responsibility. The analysis framework helps us to remember what information we need and how to use that information in analysis. There are types of data that we need on these three levels, from society to community to individual. Let us look at these parts and how we can collect data for each part of the analytical framework. We can start with the legal and justice system when it relates to GBV. If you need to know legal and justice issues related to gender-based violence, what method and source would you use? Household structured interviews, focus group discussions, non-specialized key informant interviews, secondary data review, interviews with GBV, with legal and GBV experts. Yeah. So in this case, you will use secondary data review and interviews with legal and GBV experts. Who should collect this information? This should be collected by the GBV experts. The GBV expert is the one that will go out and collect this information and engage with the legal and other GBV experts. Of the analytical framework dealing with demographic landscape. If you need to know the number of people in a country or a location by sex and age, what method and source would you use? Would you use household structured interviews, focus group discussions, non-specialized key informant interviews, interviews with health service providers, interview with GBV experts and service providers, analysis of data, of administrative data from case management? Which one do you think you're going to use? In this one, you're going to be able to use one, key informant interviews. For example, DTM, MSLA, multi-sectoral location assessment. Key information interviews can get the total number of people and estimates for age, for sex and age, however, not the prevalence of persons with disabilities. Number one, if you look at some, I'm sure a lot of people would say number one. The thing about number one is household surveys are done using a generalized sample, but you cannot get the number of people. However, it can get the percentage of sex and age and persons with disabilities when using the Washington group of questions. Let us now look at the part of the analytical framework dealing with threats and vulnerabilities of specific groups. Know the specific risks for women and girls with disabilities. What method and source would you use? Would you do household structured interviews? Would you do focus group discussions? Would you do non-specialized key informant interviews? interviews with health service providers, interviews with GBV experts and service providers, or would you do an analysis of administrative data from case management? Would interviews of households where respondents are households or head of household or other members speaking be able to tell you about domestic violence? What about focus group discussion? Can you collect it using 3 non-specialists discussions? Most probably not. In this case, what you need to use is focus group discussion. The reason that we use focus group discussions here is because you're looking at a semi-structured discussion with specific groups. It's specific risks for women and girls with disabilities, which is separate from other groups and not simply a group of people from the community. For example, women alone or children alone. This is because for a group, for example, women may not speak in front of men or other group as much as they would when they're among other women. Please note that this focus group discussion should only be carried out by GBV and protection experts. Using the wrong method and source, as in the example above, can result in misleading data that will not be able to provide necessary support, therefore resulting in harm. For example, when you're doing a non-specialized key informant interviews or household structures, they might not be able to speak clearly around the risks for women and girls with disabilities because their experiences are different. Using some methods like household interviews to ask questions related to domestic violence can actually cause harm to victims of violence if perpetrators become suspicious of the reasons behind the questions. In certain cases, the perpetrators may actually be the ones that also answering those questions, and it's therefore important to also be very keen around how we ask these questions. Now let us look at the part of the analysis framework dealing with GBV services. If you need to know what GBV services are in a location, what method and source would you use? Would it be the non-specialized key informant interviews, household interviews, focus group discussion, or service mapping? What you'd use would be non-specialized key informant interviews, focus group discussions, and service mapping. We need to differentiate when you're looking at availability about services, information on services. You need to also distinguish between availability, access, quality, appropriateness, use, and awareness. Key informant interviews through enumerators will give you information about availability, which means whether the service is present or not. But key informant interviews cannot tell us about the quality, the barriers that people face in accessing those services, and so on. Focus group discussions done by GBV experts can help us understand the barriers, appropriateness, awareness, and use. We can use expert interviews and service mapping with providers to identify quality. This is done by GBV experts. So all these methods can give us information about access to GBV services. However, it is important to take note that we cannot use household interviews, and it is dangerous to ask households due to who answers. Imagine asking about GBV services for survivors in a household where there is domestic violence. What do you think the perpetrator may think? And would you say that the other members of the household and the enumerators would be at risk by the question alone? Now let us look at the parts of the analytical framework that indicates types of GBV. So what would you use if you need to know types of GBV in your location, in a certain location where you want to operate? Would you use household structured interviews, focus group discussions, secondary data, interviews with GBV experts and service providers? Or would you interview health service providers? Would you do an analysis of administrative data from case management? In this case, the recommended is that you use secondary data, which would now be looking at existing research and reports that would be detailing what types of GBV are present in that location. You would do interviews with GBV experts and service providers as they are responding, and they would know what would be the types of GBV that they are seeing. You'd also talk to health service providers because they're providing services to GBV survivors and don't have information. And you can also look at analysis of administrative data from case management. So who should collect this data? This should only be done by GBV experts and not information management or DTM. The reason we do not use household interviews is because there's the same risk as what we have just discussed in the slide before. Asking these questions at a household level could put people at risk, especially if the perpetrator of the domestic violence or type of violence is in that household. If you need GBV prevalence data, what method would you use? Prevalence means how many incidents or survivors of GBV there are in a location. Would you use key informant interviews by non-protection experts? Would you use expert interviews and service providers, personnel, so protection, GBV, child protection? Would you look at official government statistics and police records? Would you go to case management actors and ask for information on case management or case management data from GBV child protection actors? Would you do interviews with household representatives or interviews with individuals, specifically women and children? Or would you be looking at other groups? How would you do that? I got you. Yes, this is a trick question. We cannot and do not need to collect prevalence of GBV. Let me clarify. We may obtain the number of married children, though carefully phrased and collected interviews with the households can share information around demographic roster, but will not be able to know how many children, women or men have been raped, maltreated, trafficked, involved in hard labor, or such other information. And they're not going to be collected in most of the contexts where we work, regardless of the method and source used. The reason is that these phenomena are hidden, taboo, and crimes. The people interviewed will not be able to answer honestly or openly or with precise information because they do not know or do not dare to respond. Some of our protection experts on the call may wonder, why not use case management data or data from the police on reported cases as prevalence, because that's also been the case. But the answer is no. Case management data tells us about the beneficiary of the services. So in this case, it would be about the number of people who have accessed GBV services. And it only tells us about the incidences that have been reported to that partner who's doing case management or to police. The data is telling us the report, which are often, in the case of GBV, we know, is often fewer than the actual cases. The limitation with using this aggregate data is that, firstly, all incidences, GBV incidences, are underreported. So case management does not capture unreported cases. Also remember that case management only captures incidents reported in places where we or other organizations already work and where there is trust in the system. So it will not provide information in locations where no one is working or where they do not trust organizations working in the region. So even if we consider police records or cases of service provider, we can only know the number of cases that were reported, which is often fewer than the actual cases. If we communicate reported cases, then it's likely that donors and others reading this report will interpret this as prevalence and will contribute to lower funding for protection programs. The good news is that we overestimate the usefulness of prevalence data, and we do not need it. We do not need to know how many cases of violence there are in a community to open services to help service survivors. There's an agreement in the humanitarian community written in the 2015 Interagency Standing Committee Guidelines on GBV, which states this, that all humanitarian personnel should assume GBV is occurring and threatening affected populations and treat it as a serious and life-threatening problem and take actions based on sector recommendations in the guidelines, regardless of the presence or absence of concrete evidence. So let us learn to program, work, and survive without prevalence data and collect the data we really need. Think of what you want to decide. Consider whether or not you need to know the number of incidences, and you'll quickly find out that you don't. You need other types of information for the decisions on where to work, what to do, and how to implement. For example, we can use focus group discussions and interviews with experts to understand common patterns of protection incidents, which groups are most at risk for each type of violence, which elements increase or decrease the risk of violence for each group. You can use data on reported cases to obtain qualitative information on the types of GBV incidences reported, the dynamics, and the modalities of the incidents. As another example, the number of reported cases can help us to estimate how many social workers we need to hire and how much money we need. However, these are not, I emphasize, prevalence data. They are reported cases, a much smaller subset of the actual incidents. If you're being pressured by donors and others to collect this information, remind them that the Interagency Standing Committee directs humanitarian service providers to assume that GBV is happening in every community and that emergencies create harmful living conditions and break down social protective structures that increase risks. Show them your data on GBV risks, the dynamics, resilience mechanisms, and the gaps in response. Remember that when we do not use the appropriate method and source, we risk to do harm. Let us now consider tips for better cooperation between information management and GBV colleagues. First tip to consider when designing the questionnaire: will the answer tell me something that I already don't know? So you want to be looking for something, what don't I know? Do you need key informant interview or household interviews to confirm that child marriage is happening if you already know it's a cultural phenomenon? Do we need to interview women migrants in Libya to find out that many Nigerian women are trafficked to Europe for prostitution? Do we need to ask them about the violence they experience when you already have that info from the stories of the ones who escaped the traffickers in Italy and are now safe. Don't forget to read other studies, including academia, local civil society, and other UN agencies. Google the issues before you start collecting data, and ask your colleagues also in other organizations, local NGOs, and research centers. If you don't know how to use certain information, do not include it in the questionnaire. If you do not have a clear plan on how to use the results, you do not need that information. When designing the questions, use clear language. Do not use technical language or lingo or words influenced by capture. An example of technical or cultural lingo is we start by the term GBV. For example, who understands what GBV services are? If you go to the community and ask, who will understand it? The services must be listed in the question. Do not say, do you know which type of GBV services exist? List the services in the question. Use clear language that must be understood by non-GBV actors. Other examples are heads of household. This is unclear for many whether this is economic head of the household or the oldest family member, the caregiver, the decision maker, or combination of several of the above. Unaccompanied children or separated children or even children in many cultures, 16-year-old and below, are not considered children. Above, who are considered 16 and above, are not considered children. In several countries, it's included in the numerator package, but it didn't work. You need to write the questions clearly and simply in the question text. It is advised to have staff who speak the language in that context to check the language for clarity. Ask your national staff to check the language for clarity. For example, asking, are there unaccompanied children in this location to a key informant, and having the definition in a glossary does not work. The question needs to be worded, are there any children under 18 years here without their mother or father or any other adult family member? This is what is provided in the DTM Field Companion for Child Protection and available on the DTM and Partners Toolkit page. When designing questions, it's always good to check with your national staff for risks or sensitivities around this question. So it's important to do a risk assessment around the questions that you're going to ask. Culturally, we may not know what is taboo if you're not from that area. In Iraq, for example, we could ask about armed persons in or near the camp. But the question on pregnant and lactating women was very hard for the enumerators to ask and did not give us good data. Before data collection starts, prepare your information colleagues to safely manage GBV disclosures. There's a separate session on this, but it's essential to remember already that you have to prepare for protection incident disclosures. This is more than a tip. This must be done in your planning. Enumerators should be equipped to respond to incident disclosures and need the support from protection colleagues in referring to services. They should be ready to know how to safely respond to incident disclosures before they go to the field. It means knowing what to do and what not to do, and having the up-to-date information to share on available services and know who to reach in the protection team for advice if needed. So it's important to always remember three things. Look, listen, and link. When you're looking to see what are the most urgent needs and that this person needs. Consider immediate safety plans, Is there a safe place? Is this person comfortable talking to you in that location? Could you take them somewhere else? Listen to the person. Make sure you help them to feel calm. Do not ask details about the incidents. Should not be any questions directly asking people about experience of sexual or gender-based violence, and the enumerators should be trained to never ask for details even when the person is volunteering the information. No noting down details about a violence case. Enumerators should not remain and listen to details. The enumerator should explain to the person that they are not an expert, but can refer them to an expert if they wish to talk to them. Ask about needs and concerns. Then share the information on available services, including who is a GBV focal point or child protection focal point in that area. Linking means sharing information on available services to help the survivor. This is an essential role for GBV and protection colleagues, ensuring the services are available and accessible and that there is a referral mechanism. And they need to share the updated lists of services and focal points with enumerators and train enumerators on how to refer or share information. When collecting data, always use gender balanced enumerator teams, having men and women help in interviews and observations, as different people observe different things and respondents react differently to the question depending on who asks it. When analyzing, information management colleagues should present their main findings to GBV colleagues. It helps analysis and using the data if the GBV experts are gathered in a room and IM presents the results. Remember to always respect each other's competencies and work together. Data collection, information management, and GBV are specific profession competencies. For example, GBV colleagues do not design key informant questions, and information management colleagues do not handle GBV cases or ask sensitive questions. Let us now conclude. Remember, collect only the information that you need to make decisions and only what you do not already know. Each information should be collected through the appropriate method and source and by the colleagues with the right expertise. Use all useful data, including existing data from other actors and data collected through different methods and sources. Focus data on GBV risks and the impact of those risks. Do not ask people about their traumatic experience if you're not a GBV expert and managing a case. Do not try to collect prevalence data. So you must be thinking by now, where do I find tools and more information? You can find support material on the DTM and Partners Toolkit and under DTM for GBV. The Global GBV AoR worked with DTM to be able to produce DTM for GBV. This is a 4-page guide that can be able to be also useful for you in working on this. We mentioned before that it's always important to do secondary data review. You can start off from the GBV, the Global GBV AoR website, and also consider others in terms of academia and other materials that might be there. There's additional materials on how to handle incident disclosures or GBV disclosures. You have the GBV constant companion. You have how to support gender-based violence when a GBV actor is not available in your area. Please review and check these materials. There's a DTM and Partners Toolkit YouTube channel. Please go through and see what there are many videos in there that has material and content. And this is updated regularly, so you can be able to use it for your needs as they arise. Thank you for listening, and please check out the other videos on the YouTube channel. All the best.